Hello, everyone. My name is Dr. Kate Burke, and I'm the Senior Medical Advisor here at Patients Like Me. We are teaming up with Bayer to bring you this webinar about chronic kidney disease in type 2 diabetes, also known as diabetic kidney disease or diabetic nephropathy. The focus of this webinar is intended for patients living with type 2 diabetes. For this reason, when we refer to chronic kidney disease, we are specifically talking about chronic kidney disease in patients who also have type 2 diabetes. To help lead this discussion, I'm joined with Dr. Kramer, who is the immediate former president of the National Kidney Foundation. Dr. Kramer, can you briefly introduce yourself?
Yes, thanks, Dr. Burke. I've been a practicing nephrologist for over 20 years, and I've seen many patients transition from chronic kidney disease to chronic kidney failure. So I'm very eager to help patients determine whether or not they have chronic kidney disease so they can self-manage their disease better and prevent kidney failure.
Great. Thank you so much for that, Dr. Kramer. The topics we will cover in this webinar come from the questions submitted by our members. These topics have been summarized into 5 key areas of interest: a general background on kidneys and chronic kidney disease, the risk factors, early symptoms, and the link between chronic kidney disease and type 2 diabetes, the seriousness of kidney damage, how to talk to your doctor about chronic kidney disease, and the types of health screenings available to detect kidney damage, how to keep your kidneys healthy and prevent or slow further damage. And finally, the key takeaways and conclusions from today's conversation. We hope that this webinar will give you a better understanding of how important kidney health is for all of us, especially for those living with type 2 diabetes. It might be helpful to first go over the importance of our kidneys and their role in our bodies. Dr. Kramer, do you mind giving us a little background on our kidneys and what they specifically do?
Sure. Your kidneys are just as important as your heart. Your kidney's main job is to filter the blood and remove waste and extra water which leave your body as urine. And your kidneys help control your blood pressure and make hormones to keep your body healthy. And as the kidneys are being damaged by kidney disease, they leak protein in the urine and produce a buildup of waste products.
Thanks for that helpful overview. What exactly is chronic kidney disease?
Well, chronic kidney disease is where patients have either reduced kidney function or kidney damage or both. Advanced stages of chronic kidney disease lead the kidneys not being able to filter the blood properly, and harmful levels of waste products can build up in the body. And chronic kidney disease is actually one of the most common complications of diabetes.
Thank you so much, Dr. Kramer, for that important information about the role kidneys play in our bodies and their overall importance. Next, we'll discuss the risk factors, symptoms, and connection between chronic kidney disease and type 2 diabetes. Many of our members have questions about who is particularly at risk for developing chronic kidney disease, especially those with type 2 diabetes. Can you explain the risk factors for chronic kidney disease?
Sure. Up to 40% of individuals with type 2 diabetes may develop chronic kidney disease during their lifetime. Other risk factors for chronic kidney disease include elevated blood pressure, family history of kidney disease, especially if you have a first-degree relative who's been on dialysis, being of African American, Hispanic, Asian, American Indian, or Pacific Islander descent, if you're an active tobacco user, or if you're overweight or have a high body mass index.
We as doctors know that type 2 diabetes can lead to chronic kidney disease. Why is this the case?
Well, there's a connection between high blood sugar, high blood pressure, and chronic kidney disease. And these two factors combined can cause kidney disease to worsen and progress over time. So your kidneys are basically made up of a lot of small blood vessels, and the high blood sugar can permanently damage these small blood vessels and lead to kidney damage. And then this can then further lead to damage to other organs like your heart. Damaged kidneys can also release too much of an enzyme called renin, and then this can lead to high blood pressure and make kidney disease worse, which then increases blood pressure, and it just creates this dangerous cycle.
Another common question we receive from patients is how to tell if they have chronic kidney disease. What are some of the symptoms of chronic kidney disease?
Well, a key takeaway is that chronic kidney disease may not present any symptoms during the early stages. You may not experience symptoms until you reach kidney failure. So it's important to talk to your doctor about getting a simple urine test where they measure how much albumin is in the urine, called the urine albumin to creatinine ratio. And that's one of the earliest ways to detect kidney damage. Kidney disease can lead to kidney failure, where kidneys can no longer perform their functions.
Thank you so much, Dr. Kramer, for that important information surrounding chronic kidney disease risk factors, symptoms, and its connection with type 2 diabetes. Next, we'll be talking more about why it's important to get ahead of kidney damage in the first place and what screenings are available for chronic kidney disease. Many patients want to know, why is it so important to get ahead of kidney damage? Can this damage be reversed?
Well, chronic kidney disease is permanent and it can't be reversed in the majority of the cases. When the kidneys are damaged and scarred from inflammation, they can't remove toxins from the blood. And then this causes more damage to the kidneys and other organs like your heart. It can severely impact your overall health and impact your life. So catching it early really gives you an opportunity to make the lifestyle changes you need to slow progression of kidney damage and prevent kidney failure.
Kidney health is so important, which is why it's critical to get tested for chronic kidney disease in type 2 diabetes so you can get ahead of any potential damage, as the condition usually has no symptoms until later stages. How should someone start the conversation with their doctor if they are at risk for chronic kidney disease?
It's important to have an open dialogue with your doctor about chronic kidney disease. Advice for starting this conversation would be ask the doctor about kidney disease and your kidney function directly. Be clear when asking about your health and how you can protect your kidneys because you're your best advocate. Bring a copy of your latest lab results if you have them. Send questions to your doctor ahead of your appointment if you have a patient portal. Have your questions written down. Give it to the medical assistant when you check in for a clinic visit. And a list of questions you can ask your doctor about type 2 diabetes and risk for kidney disease is seen on this website that you see here on your screen.
That's really great advice, Dr. Kramer. Something that our members have also found useful is to keep a list of all your medical conditions. The doctor's visit guide on Patients Like Me is especially helpful for organizing health information that you track for your upcoming appointments with your healthcare providers. In addition, it can help you identify any questions you may want to ask your doctor so that you can get the care that works best for you. One good question to ask your doctor in regard to chronic kidney disease is, how often should you get tested for chronic kidney disease? Dr. Kramer, what would you suggest to patients?
It's important to have your kidneys checked regularly is because of this lack of symptoms. The American Diabetes Association recommends you get tested at least once a year if you have type 2 diabetes.
Prevention and awareness is so important. What kind of testing should patients be asking for?
Well, it's actually pretty simple. First, you need a urine albumin to creatinine ratio, otherwise known as the UACR urine test. It's used to test for kidney damage. And then you have the eGFR, also known as the estimated glomerular filtration rate, which is a blood test to test for the kidney function. And these tests are then used together to see if you have kidney disease.
Are these tests included in routine checkups?
Well, a UACR, that urine test, is usually one of the earliest indicators of kidney damage, but it's not always part of routine health screenings.
Mm.
It's also different from a usual urinalysis or dipstick tests that are commonly used at doctor's appointments. So ask your healthcare provider specifically for this type of test, the UACR test, where you simply urinate in a small cup and they measure how much albumin is in that cup. So talk to your doctor about getting a UACR test so that you can take steps to get ahead of any further kidney damage.
Dr. Kramer, can you describe what a UACR test is?
Absolutely. So remember, you're just going to urinate in a small cup. So you're not collecting your urine for 24 hours. It's just a one-time spot, random urine specimen. And in that specimen, they will check your urine for a particular protein called albumin. In a healthy state, there's very little albumin that's in the urine because the kidneys do not allow albumin to pass into the urine. So if you see increasing amounts of albumin in the urine, that can be an early indicator for kidney damage.
That's great information to be aware of. You mentioned an EGFR test earlier. Can you describe what an EGFR test is?
Yeah, so the EGFR stands for estimated glomerular filtration rate, which is the kidney function. And it's measured with a simple blood test that measures your kidney function based on how well your kidneys are filtering a waste product from the blood. So the EGFR is based on this waste product called creatinine in your blood. And creatinine is a waste product which healthy kidneys remove from the blood.
Mm-hmm.
So as kidney disease gets worse and your kidney function declines, then less creatinine is removed by the kidneys, which leads to higher levels of that creatinine in the bloodstream. You may see the EGFR test on your diabetes panel, but remember, it's also important to also get that UACR urine test because the UACR test can detect kidney damage earlier and may be detecting things before you'll see any changes on that EGFR. An early detection is important. Once kidney function begins to decline, damage cannot be reversed.
Thank you so much, Dr. Kramer, for that information surrounding why it's important to get ahead of kidney damage and how to be tested for chronic kidney disease. Next, we'll be wrapping up with how to keep your kidneys healthy and prevent further damage. One of the first questions that patients often ask after receiving a chronic kidney disease diagnosis is what they can do to keep the kidneys healthy. What are some of the best ways our members can help slow the progression of chronic kidney disease?
Well, if you catch kidney disease early and make nutritional and lifestyle changes, you may be able to slow kidney disease progression.
You mentioned that nutrition and lifestyle changes are important to slow the progression of chronic kidney disease. What are some of these types of changes you would recommend to patients?
So I have 4 main recommendations to help with regards to kidney health. First, it's important to maintain a healthy weight because being overweight is linked to high blood pressure, heart disease, and chronic kidney disease. Second, manage your diet by following a kidney-friendly meal plan. Third, exercise at least 30 minutes a day, most days of the week. Physical activity may help prevent heart disease, improve glucose control, and maintain muscle mass. And the last one is don't smoke. Cigarette smoking is associated with progression of chronic kidney disease, and smoking also contributes to death from stroke and heart attacks in people with chronic kidney disease. If you do smoke, talk to your doctor about how to quit.
Those are all great pieces of advice. Many of our members with chronic kidney disease wish that they had known about the effects that certain kinds of medication can have on kidney health. What are some of the recommendations you would give patients in terms of managing medication and getting necessary support from their doctors?
Well, avoid the overuse of non-steroidal anti-inflammatory drugs called NSAIDs. Those are over-the-counter medications that you use for pain control, and they can damage the kidneys. Take medication as prescribed by your healthcare provider and always consult with your doctors before making any changes to your medication. Schedule regular checkups with your doctor to monitor your kidney function.
Thank you so much, Dr. Kramer, for that information surrounding how to keep your kidneys healthy and prevent further damage. To conclude today's session, I'd like to end by summarizing the key takeaways from our conversation today that highlights the most important information our viewers should leave with. I'd also like to thank everyone for joining us today. We're so happy you were able to tune in. Dr. Kramer, do you have any key summaries from today's conversation? What are the 3 to 5 key takeaways from today's discussion?
Well, I'd say that the main takeaways are, number one, chronic kidney disease is quite common among patients with type 2 diabetes, and the damage is permanent. It's very important to know the risk factors and talk to your provider about prevention and management. And number two, there are often no early symptoms of chronic kidney disease. So remember to talk to your doctor and get that urine albumin to creatinine ratio test, that UACR test, which is one of the earliest ways to detect kidney damage. And it's important to know your numbers and work together with your healthcare team to make a plan to protect your kidneys. And finally, if caught early, you can take steps to delay the progression of chronic kidney disease.
I hope we were able to answer your questions about the importance of chronic kidney disease and its connection with type 2 diabetes. Be sure to stay on the lookout for a future Q&A where I will be answering member questions on this subject. Thank you to everyone for joining our webinar, and thank you to Dr. Kramer for joining us here as well.